Beach, California, and I mostly focus on acne, on scars, on pigmentation, and also just anti-aging. So I want to showcase this patient because he wanted to improve his oil production, and we achieved that. He wanted to remove a couple moles over here, and also we wanted to brighten up his skin. He was concerned a little bit about his pigmentation. So we did all that actually for this patient. We ended up controlling his oil glands. We took away his moles, and then we also actually removed some of his hyperpigmentation with the Pico laser. So that's a really nice process over here. So take a look at this. You can see a wonderful result here after using the Accure laser for oil production. So take a look, you can see that process right now. And this is what we do a ton of. We do a lot with patients that are concerned with their acne. And in this case, this patient's acne was under control, but he was basically concerned because he was just drenched in oil. And when he was drenched in oil, he was basically feeling that, especially in the summertime, it was, hey Miriam, how are you doing? In the summertime, it was getting really, really problematic for him. So you can see we improved his oil production, we got rid of his moles, and then also picked up his pigmentation with the Pico laser, did all that, and we're in his natural skin tone. And so that's something also I want to talk a little bit about, because I know I've showed this patient before to talk about his oil production, but this time I also want to talk a little bit about how we can also make sure that people are looking back to their natural skin tone. And I do that a lot with the Pico laser. Miriam's asking, have you ever heard of an ATA peel? Let's go take a look and see what the ATA peel is. We're going to investigate with me to see what is in the ATA peel and see what it's for. What are you trying to use the peel for? That's a bigger question. What are you trying to do with that? So ATA peels or TCA peels. Okay, so a TCA peel. So it sounds like well, I guess with your skin tone, you just got to be careful with that. But it looks like it's probably, it's a 10, 30, 50%. Interesting. Why aren't they just calling it TCA? But they're saying it's got TCA in there. Blue saying, hi doctor, what laser was done here? This was with the Accure laser. This was also with the Pico laser. So we did both of those. Miriam saying that she saw somebody using that in Brazil for scars. Well, you could do TCA for scars, not the best in my mind. Really, it doesn't stimulate as much collagen production as you would want. So I don't know. Honestly, I would take a look and see what the results is. Make sure it's standardized. I don't know. Joy is saying natural skin tone. Does that happen when you're doing lasers for texture? So when we're doing texture, we're not really solving your skin tone per se. We're really mostly just working on the texture, and then afterwards we try to solve your pigmentation. I do creams, topical creams with that, and I also do the Pico laser. So those are the things I do for pigmentation. So in this case, for this patient, he was wanting to get his oil production under control, so we did the Accure laser for that, worked beautifully well for that, and then on top of it, we ended up picking up his pigmentation. And so this was a patient that did 3 sessions of Accure, and then actually, I want to say 3 sessions of Pico laser. So just about that, and then 1 session of mole removal. So that was it, and you can see really great results here. Ashwi saying, would you recommend red light therapy mask for acne and acne scarring? Probably not. Honestly, I think it's pretty mild. I'm going to do a thing where we're just going to investigate things. I'll try to get my computer set up for that really quickly, maybe like during this week. And we'll kind of like investigate with us. And so we'll just see I'll go through some of the studies that we'll collect some of the studies, and we'll go through how to read the studies. Now I can do that really well on here. So I'm going to do this where we could just kind of go talk a little bit about what studies are out there for red light therapy. Is it really going to help out too much? Yeah, I think that even if you did multiple times, it's probably not going to help enough for scars. But it does stimulate a little bit of collagen, so maybe it softens it a little bit. So maybe that's good for you if you have mild superficial scars. Hey buddy saying, was his acne mild? It was really mild. He's mostly concerned with oil production, so we did it for oil production for this case. Blue saying, did he have inflammatory acne or just oil? So he used to have bad cystic acne, Now he just had a lot of oil production, and you know, the oil was just so severe last summer, not this summer actually, I should say last summer, last year, and so he really wanted to get that under control. And this summer it was really, really good. So really nice to actually see that, despite the fact that this summer was really, really hot. So that was good. Teffy saying, I have 3 spots where I'm losing melanin and don't think it's vitiligo. Could it be pityriasis alba? Yes, it could be that. We actually could do, I'm getting, in a couple of weeks, I'm going to be using something called the Excimer laser. You're going to see some of the hypopigmentation results that will showcase that. I told you guys that we're going to do a lot more with that for next year, but I'm going to start that process right now too. So we're going to be using an Excimer laser for hypopigmented areas. So that's going to help out. You just need a lot of sessions with it, though. That's the one thing with it, though. Unlimited is saying, what's your recommendation to young adults with prematurely aged who wants 0 fine lines under the eyes? You could do, well, how old are you though? I guess young adult depends on what age you are. User 65 saying, what percentage of TCA do I use? I actually don't, the one thing I don't talk about on here is the percentages of here, because people just try to copy everything about that and just do that. So I usually don't do, I mean, patients. I don't talk about other people. I could care less if other doctors want to copy it, but I'm talking about patients that like are doing that at home and it's risky for them. So that's one thing. So I don't typically say the percentages directly, but I could say it ranges. Typically, I could do a 35 to 90%. Really just depends on how deep it is for that. Bao Kimmy saying, do you remove the mole? Sorry, just coming in here. Yes, we removed the mole as well. We did Accure laser and also Pico laser. So we did the Accure for the oil production, and then we did Pico laser for the pigmented areas there. Can I talk a little bit about hydrofacial? Sure, it's just going to be mild. Honestly, I don't really recommend it during the Cure sessions because I still find that sometimes it could be a little bit too irritating for some skin. So I try to just make sure it's really limited for what people do for that. How much for mole removal? You know, I'm not sure. It's usually just a couple $100, I think. It depends on if we need to send it for pathology or not. Let's see here. Unlimited was saying I was about to answer the question. What was the question actually? Oh, well, how old were you? That's the question was. So you said for a young adult with fine lines. It just depends on how old you are. Let's see here. How long does tretinoin take to show progress? Probably about, well, it depends on what you're trying to solve. Trying to solve acne, it could take just actually honestly about 4 weeks. Scars, like mild scars, you may see some improvement about 6 to 9 months later, potentially. It takes a while though, honestly. Let's see here. I know I missed a bunch of things here. How do you treat acne at your office? So basically we could do topical creams, of course, usually like a topical antimicrobial agent like dapsone, clindamycin, and then also potentially like a retinoid, like tretinoin. Those are all good options. If we are trying to do more long-term solutions, then we could do isotretinoin, especially for cystic acne, or we could do the Accure laser. So the Accure laser works very, very well, just like Accutane works, and normalizes the oil gland. So that's really the different ways that we would do it, though. So it just depends on what's what's going on with you and what you've tried already before. Unlimited is saying, just in general, can you give different advice for the different age ranges for fine lines under the eyes? So with fine lines, typically, if you're basically 20s, in your mid 20s, you could do a little bit of micro Botox there. Tiny little bits of micro Botox works really, really well, and that's going to help prevent actually damage and just causing the skin to get looser. As you get a little bit older, 35 plus probably, then you may want to consider something like a lower energy laser. Potentially I would do like an Erbium laser over there. Now, if you're in there like mid 40s, 50s, and there's a little bit of loose skin there, then we may want to do something more for skin tightening. So either a CO2 laser, or we could do Morpheus 8. So hopefully that helps you out with that though. So Botox is for dynamic wrinkles though. What about premature static wrinkles? So if it's premature static wrinkles, then we probably would just jump ahead then and go right to doing something like an Erbium laser there. If you're darker skin tone, then we could do more Pico lasers, but usually you want to take a few sessions there. Nune saying, after liposuction on my neck, I have loose skin. What do you recommend? Face tight. Face tight works really well for that. We could go inside there, tighten the skin, face tight, neck tight. Works really well for that. Go in there, heat and contract the tissue. That's going to help out with you. Let's see here. Unlimited saying he's got sun damage. It has premature static wrinkles. So then yeah, a laser like the Erbium laser could work really well for that. Let's see here. Is azelaic acid better than adapalene for scars? I mean, probably neither is the best for it, but between the two, a retinoid is going to be better than just azelaic acid. So, in general, I wouldn't really say that any topical exfoliants like azelaic acid, glycolic acid are going to help much with scars. Really, really mild, if anything. Gabe, if you have a question, just ask it here. You don't have to DM me. Chances are, honestly, I don't usually check the DMs. Most of our team does, so I usually don't look through most of those. Some here and there, I may look at it here and there, and you will know when it's me. But in general, it's like most of my team is taking care of it. So I'm accessible right now, so just ask me right now. Thoughts on Erbium and IPL laser for darker complexions. IPL is really high risk. I think it's one of the most risky energy devices. I've talked a lot about that before. I don't recommend IPL for darker skin tones. Erbium depends on where you are. Miriam saying, I want to get Accure, but I'm scared to go off my tretinoin and break out. Well, we could probably gap you. We probably would do, we could do topical antibiotics, and then we could do something like a lower dose of like some azelaic acid, potentially like 10% azelaic acid. Sometimes I do that just in between times when we do it. But I hear you, and then also we may just want to do, if you get a breakout, just a small burst of oral antibiotic. But really, our purging is really under control now. I hardly have any patients who purge much, so it's really, really less likely there. Let's see, what was done in this patient. This is the patient we did a Accure laser first, and then after we did the Accure laser, we went after his pigmentation. He also did mole removal over here. So you can see a few different things, a few different steps right there. Let's see here, large dark spots. Well, we can use the Pico laser for large dark spots. That works really well. Amy's saying, can you talk about what works best for ice pick scars and vascular dark circles? Yeah, it's good. Two good questions, actually. So ice pick scars, TCA cross, really. So that's what I would do. So TCA cross, we would recommend that. And then sometimes some laser. And then vascular dark circles, then what you usually want to do is either like XLV could work well, or you could do, potentially, you could do PRP. If it's something that you just want to get some more blood flow there, that could potentially be a good idea. The Kushkum Sun says, coming to see you 4 months or 6 months after acne make a difference for scarring. Well, the sooner the better, but I just do want to make sure that acne and oil is under control first before we start the scar treatments. We really will be able to really maximize results when your acne is under control and your oil is under control. It's super critically important. Now, have I had excellent results even in patients when they had breakouts afterwards? Yes, it's true. But ideally, more collagen response is going to be like that. We're going to be able to help out with that. Wonderlust is saying, Dr. Qazi, insane question. Can Invisalign cause worse nasolabial folds and mirroring netlines? Potentially, because it's sort of just kind of pushing out there, pushing on your lips, which could cause it. But, one thing that you may want to consider doing, not that this is like the solution for all of us, but you should actually consider using mouth tape when you have something like Invisalign, especially because you may end up having your mouth open a little bit, and that could potentially be causing some of that laxity around there. So that's possibly a reason why. So use mouth tape at nighttime. It's going to help you out. What brand of azelaic acid do I recommend? Actually, Paula's Choice is good. It's got a nice azelaic acid over there, so I would recommend that. Let's see here. Yami saying that he or she is breaking out so bad right now. Okay, so if you're breaking out right now, try to get some sort of topical antibiotic, potentially like Dapsone, clindamycin, good options. And then also an oral antibiotic like doxycycline. That'll really knock it under control. It depends on, especially if you're saying it's so bad. If it's just like 1 or 2, then yes, you could use it like a pimple patch. But if it's really like it's so bad, then you really do need something like a topical and oral antibiotic really to under control it. Let's see what Gabe is saying. The picture above, how much would it cost for removals? I'm not sure offhand, to be honest with you, how much it will cost. I think some of our prices are online, but it may be a couple $100 each one, I think. I'm not sure. Let's see here. Mona esthetician saying it goes and comes back for the worst hormonal acne. Hormonal acne, then go on spironolactone. Try spironolactone. Try Winlevi also, topical Winlevi. I know that people say that it's equivalent to spironolactone, but I do think spironolactone could be better, honestly. Sal is saying average scar remediation costs. Most patients for their scars spend about $5,000 to $7,000. Most patients. So especially for cases that really involve more combination sessions, breaking up the scar tissue, TCA cross, laser, plus or minus a little bit of volume there. So that typically is the case. I see Saja saying, can you elaborate on what you mean by where you are for erbium laser? Well, what I meant is that who's doing the erbium laser on you, because even an erbium laser in the wrong hands, it could be really, really risky. I've had a lot of cases that I've seen elsewhere. A lot of people come to me when they got burned elsewhere. And it's, I've seen patients where they've even gotten scarred from the erbium laser. Hyperpigmentation has happened as well, but I have seen patients who have had scarring as well. About Kim is saying, what if you still have active acne after 3 Accure laser treatments? Is it common? Not so common. Maybe about 5% of patients could still have that. So you could need a 4th session, which we have on your file to do that. But more likely, actually, we still actually have to solve your antibiotics. We have to typically do something with a topical antibiotic, so maybe potentially dapsone or clindamycin. Usually topical is what I usually do, but there's some sort of bacteria that's typically still on the surface there. So even if your oil is under control, you still have some bacteria there, and we want to control your bacteria, and that's what we're going to probably try to shoot for. So we want to usually do something like dapsone, clindamycin. If you have it really bad, then we may want to do an oral medication just for a short burst. But really, one of the patients I did acne scar sessions on, now she's actually somebody that I did the Accure back in July. So we had a few sessions of that. Then we did acne scar session on her. Honestly, oil is so well under control now. And she still, though, had a couple little small breakouts after we did the scar session. Just had to do a little bit of topical antibiotics and then it cleared up. So sometimes that happens because after we do the scars, you do get more oil production because your skin's super dry. So it's going to be really like this area where if there's any bacteria on your skin, it could turn into a breakout. So we got to control that bacteria really well. So a lot of times we'll do that for a couple more months after we do the cure, and that will end up helping out with it. Are there any, Kieran's saying, are there any eye tightening lasers for ethnic Asian skin? Yeah, one of the best is actually the Pico laser, one of the best options really. And Morpheus 8 could work as well. User saying, can I ask how you change your skin tone from before it seems brighter and a few shades lighter? Yeah, I use my pigmentation cream. I do that actually regularly. So I use the pigmentation. So that's what's funny. A lot of people say that it's irritating, things like that. Honestly, it initially was irritating for myself also. And at first I started mixing with some moisturizer, things like that. Got it my skin really used to it. And now it's like my skin craves it. The other thing that actually really helps with getting back to your natural skin tone is HelioCure. HelioCure works really well. It's not expensive. Take 2 tabs every morning. It's really nice. It works as an antioxidant basically. Every time you have a little bit of sun damage, it helps absorb the damage, the free radical accumulation there. So HelioCure is a great option actually for people. And you guys know I'm not sponsored. Actually, I had a bunch of requests. I don't know what happened, but suddenly last week I had a bunch of people ask me, a bunch of companies asking me to do some sponsorships and things like that. And I have it everywhere. I'm not sponsored, but it's kind of funny though. But like really, like I'm telling you because like I believe this stuff. I'm like, HelioCure doesn't pay me or anything like that. I just really like the product. I think it's great, a great formula. So it's no, it's not pseudoscience. I mean, I think there's enough. I think it really does help as an antioxidant. It's not going to hurt you, and do it for like several months. Do it for like 3 months or so, and just try it. It's not going to really, it's only like $20-30 usually. So why not try it and see if it works out for you. I think it worked out. I think it helps a lot of times my patients too, especially patients with like hyperpigmentation, PIH, melasma. It could really work out with that. Let's see here. Can subcision cause nerve damage? Please answer. Well, I think it's possible. Yeah, if it goes a little bit too deep, sometimes the scar is a little bit deep. It is possible. Usually, if it does happen, it's basically something where it could be just for a few months though, because you do typically want to have, or you're typically going to have a lot of collateral nerves that are going to go to that area, and that could take several months to basically go back to that spot. So unlikely to really be something permanent there. Unless you're really going deep and you're really using a lot of blades there, or just a blade over there. Isabel saying, what laser do you recommend for sun damaged, redheaded, freckle skin? We could do actually. It depends on what's happening with you, but you could actually be just doing IPLs. Actually, that could be good. Unless you have melasma, then I probably wouldn't do it that way. But you could do IPL actually, a broadband light IPL. I forgot. What am I supposed to spell out for you? You wanted me to spell something out. Let's see. How do you use tretinoin? So basically, the way I use tretinoin is 0.025% to the way we started out, and then we mix it with a little bit of moisturizer to basically start you out for the first couple weeks. and then we could slowly start tapering off the moisturizer. So, initially I use a copious amount of moisturizer, to be honest. Sometimes I do 2-3 times the amount of the pea size amount of tretinoin. And then we'll go down to like two sizes more, 2 times more than a pea size with the moisturizer on one side, and then just a tiny little bit, and then you just basically drop the moisturizer completely. And I think that's what Miriam ended up doing over here. Miriam was talking about how she used tretinoin and really didn't really have much of a purge. The other things that help actually is Claritin. For the first week, take Claritin. It actually does help with the histamine reaction that happens with that. Let's see here. I know I missed a question. A bunch of stuff. What did he have done? So basically, this patient did the Accure laser. We did that first to solve his oil production. Then we did Pico lasers to help with pigmentation, and we also did his moles, removed his moles as well. Thoughts on Winlevi? I think it's good, but the thing is that the problem with Winlevi is that it's very expensive. Spironolactone is a lot cheaper, and sometimes I end up needing to pay people still on spironolactone. So we try Winlevi for several months, and then there's still active acne, and we have to do spironolactone, and then the spironolactone does calm it down. So it makes me wonder, if it really is as effective. At some point we're going to go through all these things. We'll investigate over here. My show's really going to be like an investigative series. We'll like go through a lot of stuff and just kind of look and see what the studies are, what the data is. I'm going to prepare all that so we can get that ready for you guys. That's going to come soon. Stay tuned for that. It's going to be really cool. We'll just go through and click and go through and read the articles. You guys will like tell me any of the random things that you see on TikTok, stuff like that. And we'll investigate it. We'll look at it together and learn about it and see what's going on and learn like what works and whatnot. Can you just try tretinoin, the one without prescription, on Amazon? No, I would never do that at all. Definitely not. In fact, actually, my patient today, I don't know if you're on tonight, by the way, but my patient today, he was showing how he got some sunblock on, and he had like a UV lamp, basically it was like a mirror that showcases if there's sunblock on your face. And so he showed that the stuff that from Amazon was like fake, and it ended up being like this thing where he had to go through a bunch of different sunblocks to be able to find like the real legit one that was actually doing proper coverage. Crazy wild stuff, actually. Interesting. So I'll do that. Actually, that's a cool thing to actually learn about. Actually, I was like thinking to myself that that's not really necessary for a lot of people, but people do get a lot of stuff from Amazon. I know that. Like I tend to, I got scammed one time. I got shampoo one time, and I was like a brand that I loved, and I got it from Amazon, and it ended up being like mixed with water. And I thought for the longest time that it was like the way it was supposed to be. And then I got the real one from the real company, and I realized it was totally different. And these guys like just totally diluted it, and they were reselling this nonsense, and who knows how many times they're doing that. And so honestly, they do that stuff all the time for things that like seem like really like skincare stuff. A lot of times are like just like things are mixed in there, and the quality control is really poor. And then it's like people report that stuff and they still keep the product up there. So I don't know. Maybe they get business out of it. Maybe they make money off of that. Dace is saying, what sunblock do you recommend for oily skin? Really physical sunblocks typically are good options there. So in general, I like physical sunblocks for oily skin, things with zinc oxide, titanium oxide, and ideally, especially if melasma, iron oxide is a really good option there. So I know the problem is that people say that there's not enough tint to it. Surprisingly, interestingly enough, Neutrogena's new sunblock, I think they just came out, not super new, but like this summer, came out and actually does have a nice tint to it too. So it is actually a good option there. It's a cheap option too. So yeah, something to consider. Something to consider. Usually you want something with a little bit of tint if you're darker skin tone, because otherwise it's got a light cast to it. So that's never really great. But I do like in general. I'm not saying that there's anything really particularly wrong with chemical sunblocks, but just in general, I do like actually more physical sunblocks. I tend to for regular patients, but for short bursts of time, especially, or if you have more melasma, then you typically do need broader coverage, and something like a mesoaesthetic sunblock, which is more expensive, but it has a very high concentration of iron oxide, could be really valuable for you then. Otherwise, though, even like, depending on your skin tone, CeraVe, Cetaphil make decent sunblocks. I wouldn't mind that. And even Eucerin sunblock is actually decent. Not expensive, not bad. Consider doing it though, but really try to find something, especially with like more like iron oxide. That's a good option there for you. I personally think that there's, for especially the Supergoop products, I think it's pretty good for myself, but I have heard some patients say that with they have oily skin, it may be a little bit, that may not be the best for oily skin. I don't know if anybody has any ideas from themselves, if they felt like there's some sunblock that ended up causing it to break out a little bit more, or gave me a little bit of a problem. I know, like, for example, the CeraVe one, I found a little bit like brownish oranges for myself. I didn't really love that. That was a little bit brownish oranges for myself. So, you kind of have to take a look and see. It depends on every single person's skin tone is a little bit different. But ideally, zinc oxide, titanium oxide, and iron oxide, really, really great for sunblock. And then you want to keep on reapplying that there. Joey's saying iron oxide makes my skin purple. Well, that could actually be the case. But that being said, try to actually get something that a little bit more tint to it. So potentially that could be an option there. Or you could do something with titanium oxide, would be good in iron oxide, or zinc oxide. Let's see here. I actually use a Korean sunscreen. Yeah, some of them are good. Obviously, they're more chemical-based sunscreens. I tend to, like I said, I tend to not do much with chemical sunscreens as much. Here and there I do use it, but like I mostly do more physical sunblocks. Just in general, unless I'm like just trying to make sure get like more water resistance, things like that, then just don't, sometimes it could last a little bit longer for me. Or if I did a laser session, then I want something with a little bit broader coverage. So something like Meso Aesthetics works really well for that because it has a really high concentration of iron oxide, especially too. So even though it's a chemical sunblock, it's actually doing it more for that iron oxide concentration. Saucy is saying, yo, question. So feel free to shoot the question there, Saucy. I'm real, I'm live. I'll be able to answer it there. What are your thoughts on Seysara? I'm not sure what that is. What's Seysara? Let's see what that is. Seysara. Let's see. What is the brand name? Oh, just it's a Seracycline. Okay, sure. Yeah, that's fine. That's okay. So Seracycline, tetracycline. Sure. It's just this one. Let's see what the cost is. I want to go through Good. You guys know that you use GoodRx, right? For GoodRx, if you don't have insurance. So let's see how much Seysara is. This is sometimes what it comes down to, honestly, what the cost is. So with the coupon with GoodRx, it's $175. That's the thing. And then let's take a look and see what is, like, let's say doxycycline, for example. Let's see, doxycycline, generic tablets. Let's see how much that is. So it's $7. Not bad, right? So that's the thing. It's like, that's a problem with it. It's like the problem is that a lot of these things, and a lot of patients, they want to pay out of pocket, things like that, because their insurance tends not to cover a lot of the stuff. So yeah, it's through GoodRx. Actually, you could get it for $3.89 for doxycycline. That's the thing. So the problem is that, like, there's a lot of different things like that. I usually use Solodine also, which is minocycline, once a day minocycline. But the problem is that if your insurance doesn't cover it, it costs $200 or so. Doxycycline Gabe is saying, I think doxycycline gave me least as possible. Yeah, so a lot of times topical antibiotics is typically what I end up doing. Can you treat pitted acne scars on dark skin? Yeah, of course, I definitely could do that. I do so much with darker skin types, so I absolutely could do that. I'll show you some of that tomorrow, actually. I'll show you some results of that tomorrow. Deb Stars, which laser is better for African American? Aero laser Pico for dark scars and sun damage. Probably the Pico laser is best, actually. Let's see here. I want to finish up a few different things. Let's see here. Sam is saying, I wanted to get the Phenol peel, but I've heard about heart complications, which makes me nervous. Well, yeah, it should make you nervous. I'm nervous about it too. And I see people say all the time that they do it in the office without like any anesthesia. They do it like no one monitoring. They didn't do any workup, no cardiac workup, anything like that. So it is risky. In our office, we do it with blood work. We do it with reading the EKG. We do it with the anesthesiologist, and I do it in a surgery center. So I do all that to make sure it's super safe for patients. And it really should be something that it's like you gotta be really, really careful with. That being said, I just find that it's like a lot of times people ask me to do it, but they may not even be the right candidate for it. You may not even need it. It's really more for thick scars. Also, by the way, I think I got to double check. Next week's case, I think, is going to let me share the phenol. I got to talk to them about it, actually. Let me see. I think next week's case does let us do it, so I'll double check to see. That's going to be really cool. Let's see here. Gabe is saying it takes 10. Hey, Gabe, how are you doing, by the way? Microchanneling with stem cells. I don't do any microchanneling with, I don't do any stem cells, honestly. I don't do it. Nothing with injectables, at least right now, until I get more clarity from the FDA regarding that. I'm not really going to do that. I think I'd be worried about that. What is your opinion on the phenol peel? It really has to be really deep, thick scars. You have to have like those rough edges around the scar. That's what it's for. That's what it's going to be for. All right, guys, thank you so much. I'm going to take off right now, but I will, yes, I do Pico laser at my office. Yes, thank you so much, everybody. I'll see you again tomorrow night. I'll be able to answer a lot more questions tomorrow too.